Good morning, my name is Harjivan and this is the 360 degree of my room for the video of head to toe examination. So now let's just begin with the video. So good morning, my name is Harjivan and today I'm your RN for you. Can I have your name please?
Meenu.
And what's your ID badge number? Okay. So I have instructions for you for head to toe examination, and this will include slightly touching and exposure of the part. But I will also provide you full privacy. Are you okay with that?
Yeah.
Okay, thank you. Now I'm just going to do my hand hygiene, provide you full cut. So now let's just start with the neurological examination. So for the neurological examination, do you know where are you?
It will be the general hospital.
Okay, what time it is?
About 8 a.m.
And who is the president of USA?
Donald Trump.
Okay, so for now I'm just gonna assess the eye for the perla. Okay, you're gonna look straight. Direct examination, pupils are reactive to the light. Direct examination, reactive to the light. Indirect examination, reactive to the light. Indirect examination, reactive to the light. So for the accommodation, you're gonna look on my finger and then look at the wall. Okay, look at the finger, then again the wall, again on the finger, then the wall. Okay, could you just smile for me? Okay, could you just repeat the sentence afterwards me? Roses are red and sky is blue.
Roses are red and sky is blue.
Okay, can you just stand up and extend your arms like this and close your eyes? Okay, thank you. You can have your seat on the chair. Okay. So for the neurological examination, the patient was well oriented to time, place, and person, and the perla was reactive to the light, and accommodation was also negative. There was no negative slurred speech or facial droop was noticed, and there was no positive pronator drift was noticed. And now I'm just going to do the respiratory examination. And for the respiratory examination, first I'm just going to check the posterior expansion of the chest. Okay, can just breathe. Once again. Okay, thank you. So now I'm just going to check for the heart lung sounds for you. Okay, so there would be the 10 points in the front of the chest, and I'm just going to start with the upper points. 1, 2. I will be doing this in the zigzag manner. 3, 4, 5, 6, 7, 8, 9, and 10. And for the posterior of the chest, can you just turn back? Okay, so there would be the 18 points in the posterior of the chest, and I'm just going to start from the upper point. This will also be repeated in the zigzag manner. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, and 18. Okay, thank you. So for the respiratory examination, the posterior expansion was found to be the normal. There was no labored breathing and no adventitious sound was observed during the chest examination for the verses. And now I'm just going to do the cardiovascular examination for you. For this, I'm just going to assess the heart landmark. So for this, I'm going to place my diaphragm on the second intercostal space of the rib and exactly to the left of the sternum where the aortic valve is present. So here, the aortic valve, exact opposite to the sternum, we got the pulmonary valve on the second intercostal space, and on the third intercostal space, there is the Erb's point, and on the fourth intercostal space, there is a tricuspid valve, and in the fifth intercostal space, slightly away from the sternum, we have a mitral valve. And in the mid-clavicle unit of the chest, we have the apical pulse, which I'm going to assess for the 30 seconds. Okay, thank you. So for the cardiovascular examination, the finding was to be normal as there was no abnormal sound was heard. The heart sound was normal, S1, S2 was found. Okay, so now I'm just going to do the abdominal examination for you. Could you just lie on this? Thank you. First of all, I'm just going to inspect the stomach for any scar or any cyanosis or any edema. So there was no scar, no edema or any sign of injury. So now I'm just going to assess for the contour as well as the symmetry of the stomach by sitting here and then at the end of the side. Okay. So for my next step, I'm just going to auscultate the stomach. There would be like the 4 quadrants of the stomach. I'm going to start from the left lower quadrant. Sorry, I'm going to start from the right lower quadrant for the vowel sound. Now I'm going to move to the right upper quadrant. Now to the left upper quadrant. Now to the left lower quadrant. So for the palpation, do we have any sign of pain? Okay, so now I'm firmly gonna put pressure on the abdomen to find out any abnormal mass in the stomach, in the all 4 quadrant of the stomach. And now I'm just gonna do the percussion in the all 4 quadrant of the stomach. The finding for the abdominal examination were normal as there was no sign of infection or any injury, and the symmetry and the contour of the stomach was flat. And for any, there was a normal sound or during the auscultation as the bowel movement was 5 movement per minute in 5 minutes. And then we have for the palpation, there was no large mass was found during the examination, and for the percussion there was normal tympani sound was here. So for now I'm just going to do the neuromuscular examination. For this I'm going to assess, do you have any pain?
No.
Okay, I'm going to assess the both of the extremities, lower and upper extremities, for the edema or any injury or any bruises. So for the hand, there was no injury, for the no edema, no. Okay, so now I'm just going to assess for the capillary refill in both of the lower extremities and the upper extremities. The capillary refill time is less than the 3 seconds, and for the lower skin turgor, it was found to be normal. The skin turgor in the upper extremity is also found to be normal, and the capillary refill time is also less than the 3 seconds. And now I'm just going to assess the pressure points for any injury or pressure ulcer. I'm going to check for the knees, for the both of the lower extremities, the arm, wrist, and the knee, elbow, and the scapula. There was no pressure injury found during the examination. So for now, I'm just going to assess the muscle strength of your lower extremities. So I will be putting the pressure on your leg, and you have to just raise your leg as well as you can. Okay, thank you. For the nether leg, thank you. And for the another arm. Okay, so now I'm just going to assess for the pulses. First of all, I'm going to assess for the dorsal pedal pulse, that is in front of the foot, for the both of the feet. And now I'm just going to assess for the pedial pulse at the back of the feet. And the carotid pulse, which needs to be palpated once at a while. So the finding for the abdominal examination was also normal, as the pulses were like +2 in their normal value, and during the examination there was the contour as well as the symmetry of the stomach was normal, and the muscle strength was also found to be +5 as they had a good muscle strength, and the skin turgidity was also normal, and the capillary refill time was less than the 3 seconds. And this is the normal finding for the head-to-toe examination, and this is the 360 degree of my room for the last part of the video. Thank you.